Welcome, everybody. Hello. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I partnered with them to bring you an easy and educational workday session. Today's session is functional fitness, training for real life movement. We're going to talk about this concept of functional fitness and its importance in daily life. We'll talk about how to train for real life movements, improving your strength and mobility for activities that you encounter regularly. This session, we're going to feature practical exercises that mimic functional movements, helping you stay fit and for activities that matter to you most. So a little bit about me. I have a doctorate in physical therapy. I got my doctorate in 2010. I also have a BS in exercise physiology from Rutgers University. I'm a board-certified orthopedic clinical specialist, certified golf fitness instructor, golf medical professional, certified dry needling specialist, and also a level 1 CrossFit coach. So during this time that we have together, feel free to use the chat, raise your hand or something. You want to make this as interactive as possible so that we can make this as helpful for you. All right, so let me pull up my slides here. All right, so this is a timely topic, functional fitness. One, I've had a couple of clients in the past month with issues that have come to me, and they're fairly active. They're like, hey, I play pickleball, or I play tennis, or I run, or I golf, or whatever. Or the big one is I work in the yard. I do all this housework and yard work. I'm super active. Why do I have this pain? And with everyday function, our bodies are really good at compensating through deficits that we may have. So, I think this is a little lecture that I give a lot of people that come in, is they say that, hey, I play a sport as my exercise. I play pickleball, that's my exercise. Or I walk for golf, that's my exercise. And I tell them that it's not really your exercise. Sport is a completely different concept than exercise. Sure, it's good for you because you're staying active, but because of the way our body functions, and we'll talk a lot about that in a second, because our body functions a certain way, it's really good at compensating through movement or mobility or strength deficits that you might have. So if somebody says to me that, hey, I play pickleball or I play tennis and that's my exercise and that's the only thing I do, I usually followed up with a statement sounding like, it's not if you're going to get injured, but when are you going to get injured? It's really a lot of these overuse injuries that we see for knees, shoulders, elbows happen because of compensations that we get. Alrighty, so moving forward, hopefully this is on, hit my clicker, there it is. This is an important note. I always tell people this whenever I'm giving a talk, because I'm a medical professional. If you're dealing with something specific, please have it addressed with a thorough physical exam, because the stuff that we're going to be talking about today is going to be aimed at a broad population. And it's useful information, but very general. So if you're dealing with something specific, it might not work for you. So the other thing that we always mention, that pain should never be part of the physical therapy or medical experience. A lot of times people will go to physical therapy and then they have the experience of, hey, it hurts when I go to PT. PT is just pain and torture. And it's like, oh, this guy's a physical terrorist, not a physical therapist. I've heard it all before in my 25 years of being in the field. But really research shows that pain is a complex experience and it should never be part of the exercise or whatever, or treatment. So, another important note is that as we're going through these exercises today, make sure you have enough room to move around. Make sure that you go through them without pain, because there is an infinite number of ways that we can scale or modify an exercise or a movement so that it fits for you, it makes sense for you, and it doesn't hurt. And eventually, you'll be able to improve your range of motion, your mobility, your strength, and then get to a point where it's an exercise as we prescribe it versus something that we might scale or modify. All right, so we want to do these things frequently, especially stretches and changes of position. Our bodies thrive on motion. And if we stay in one position for any, static position for any length of time, our tissues, our blood flow, our circulation starts to, lower. The circulation goes down, our blood pressure goes down, the tissues become stickier and stiffer. And our joints become, the fluid inside our joints becomes more viscous. So, set a timer. I think, the Apple Watch is pretty good. A smartwatch is good to set a timer for every 30 minutes. You should be up and moving and get out of that position that you're in, because our bodies will adapt to the positions we put it in throughout the day. And you don't want to adapt to a bent over hunched position, right? Okay. So if you've ever been to any of my classes, this next slide should look familiar. It's basically that the body functions on this alternating pattern of stability and mobility. If the pattern is disrupted, then pain or injury is the result. So this is how we explain a lot of repetitive stress injuries or sports injuries or anything, because when we understand this pattern and we apply it to everyday function or sport, we find that if the roles are reversed, if these segments aren't fulfilling their role, then compensations occur. Say, for example, the knee. The knee is a very simple joint. All it does is just bend and straighten. And it's on this side here, the stable segments. The knee is that red circle. All it does is bend and straighten. But the segments above and below, say the hip and the ankle, they're mobile. And we want those spots to be as mobile as possible and then have the knee be stable. Let's just say oftentimes people will come in because they're sitting or they're not addressing ankle range of motion flexibility. They might have a limited range of motion, a limited mobility in their hip or in their ankle. So what happens is, as your body gets through your sport or everyday activities, because of the tight ankle or tight hip, that segment becomes a stable segment. So the roles are reversed. Now, if your body loses mobility in one of these segments, it'll take and borrow and change the segment above or below. So you can imagine if your ankle and hip are tight, your body is just going to reverse the role of your knee and create an unstable or mobile knee, because it's got to stay in balance. Homeostasis is basically what our body wants. So this alternating pattern, if it's broken or something is wrong, then we get problems. And this also goes for any type of medical treatment or physical therapy in particular, that if you are going to a physical therapist or seeking medical care for a problem in any one of these segments, and if they only focus on that segment, let's just say you have knee pain and we only look at the knee, we only treat the knee, that pain might feel better, that joint might feel better for maybe a couple minutes. But eventually that pain will come back, that dysfunction will come back, because you're not addressing above or below or the whole system. Our body is connected. It's a connected system of systems. So we want to make sure that each segment is doing their role. If I don't fix your ankle or fix your hip and you have knee pain, you'll always have knee pain. They'll always come back. And that's why a lot of times people go through physical therapy, they feel good for a couple of weeks, but then things come back because they're not addressing the entire body. All right. So on to what we're here for. Fitness is an important aspect or important concept for everyday life. It really helps with our body's durability, our resilience, so that we can do the things that we want to do and not feel limited as we age. there is this concept called the heterogeneity of aging. It states that not every 85-year-old or every 75-year-old is created equal or functions at the same level. You might feel or see somebody who might be 75 and they move around like they're 50, or somebody who is 60 and moves around like they're 85. I'm sure that you know somebody that kind of reverses that role. And the key to maintaining our independence, our mobility, our strength, our ability to live life to its fullest is fitness. All right. We want to maintain our body as we age and fulfill our role in society, in our family, and or at work. So everyday movement, we want to talk about strength and mobility. So those are the two concepts, the two big ones that we want to think about. Keep it simple. We're going to keep it simple today for our class. We're going to work on strength. We want to work on mobility. All right. Now, some key points. These are movements that we encounter through everyday life. We're always like lifting, carrying, pulling or pushing things. And when we're doing these types of movements, our body, again, is that connected system of systems. So all our joints are integrated in that movement, in that task. So when we're talking about exercise and fitness, if you're doing a movement or exercise that only moves one joint at a time, say like I'm going to lift this weight and do this, that's only one joint, my elbow, that's not very functional. Because if we were going to lift something, we would never lift something like this. If I'm going to pick something up off the floor, I'm going to use my shoulder, I'm going to use my back, I'm going to use my whole trunk to pull that and lift that. So our body functions in this integrated sense, not in isolation, because that's how life is. It's a daily activity, and multi-joint compound movements with varied accesses of motion or varied planes of motion is key. And with any exercise routine, programming, routine is the enemy. If you do something repeatedly over and over again for months at a time, you're not going to see any change. We want to shock our body into growth or improvement or change. All right. So usually when I'm prescribing an exercise routine or workout, it usually falls under these categories here. We just divide it into 6. Keep it simple. All right. And we can mix and match exercises under these categories. First, it's a simple push. Anything that we come from close to pushing away, horizontal pushes, right? So we're pushing forward like this, i.e. like a push-up or a bench press or something like that, or a chest press. And that also includes an overhead push, a vertical push, like an overhead press or a military press or a dumbbell press overhead. So that's pushing. And then the next concept would be pulling. Anything that, you do seated rows, that's a horizontal pulling, or a bent over row. We're going to go over these exercises here so we have some variety, and you can see examples of these movements so you can integrate them into your routine. But we have a horizontal row. We also have vertical rows. Vertical rows are kind of like a pull up or a pull down if you have a machine. And then the hinge archetype is basically a deadlift, where a movement that is a very hip dominant movement and very functional. If you're going to pick something up off the ground, that's going to be our hinge movement. And then we have the squat, which is very knee dominant. And that includes like lunges, getting up and down from a chair, taking stairs, negotiating up or down the stairs. Those are all functional stuff. And carrying, that's very simple, just like different variations of like, how do you bring one object from point A to point B? We have to lift and we have to carry it. And there's certain components in our trunk, in our shoulders, and our hips that need to be turned on to stabilize our body as we're carrying that. And then specifically for sports, I always include rotation. Any type of rotated or rotary type sport like golf or tennis, we can kind of program things that are in that plane of motion. Okay. So we mentioned hinging and squatting, hinge is just picking up something off the floor, like a deadlift, and then the squat, which is a lunge. It's an athletic type motion. You need a lot of ankle mobility for that. And then we have the push-pull. We talked about horizontal and vertical. Let's see here. So let's kind of go over this first segment here. Let me pull this up. All right. So the hip hinge is a very simple motion, but a lot of people get it wrong. Let's just say I'm going to pick something up off the floor. Let me grab my kettlebell here. Here's my little weight. I put this on the ground, or that could be something simple as a laundry basket. If we have something that is like an odd object that doesn't have a handle, like this ball, it doesn't have a handle, how are we going to pick that up? So we want to protect our spine. The space between these two hands, which is my sternum and my pubic bone or my belly button, those two hands, once we are standing and we're upright, as we move with this hip hinge movement, these hands should never come together, which would be rounding the spine, or come apart. All right, we call this the two-handed rule. So we want to keep this all engaged, our core, as we're going to do this movement. So the movement is basically feet about hip width apart, and we're going to send the hips back. So as you can see, my hips go back, my knees are bending slightly, but my shins are very vertical. So I'm just going to check in the camera here so we can see which angle we've got here. So when I do this, a lot of times people don't have the strength and the awareness to control this muscle back here, your glutes. So they'll start to use their thighs. And this movement turns into this. I'm bending my knees, I'm squatting, this is a different movement pattern, a different movement archetype. When we want to do a hinge, it's this. I'm keeping my back straight, but it's not vertical. A lot of times people will either pick something up where they're rounding the spine and then they're trying to do repeatedly coming up like this. So again, the two-handed rule, if I'm rounded like this, these two hands, these 2 points have come together, and that's not a stable segment. The lower back is classified as a stable segment. So when we're hip hinging, we keep the hips back, and we create a big crease through here, and whatever that object is, I'm going to grasp it. My knees are vertical, my shins are vertical, and I come up, and the movement is up and down like that. If I grab the kettlebell, it's the same thing. I'm going to come back with my hips and then stand and then keeping my back and my core engaged so that that angle, that two-handed rule doesn't get violated in that hip hinge maneuver. All right, that's a simple movement that you can do, but it's actually very functional, and you encounter that through everyday life. Because our body functions on that alternating pattern of stability and mobility that we talked about earlier, and we oftentimes get compensations. A lot of times people have a hard time doing this maneuver because of something going on, either hip weakness, immobility, core instability, something. So that's a key one to practice. Now, the other one that we mentioned was the squat. The squat is simply just coming up and down from the chair or seated position. Now, here, my knees will come forward and bend more than the deadlifts or that hip hinge archetype, right? So from the side view, it looks like this. My knees go forward and my trunk is a little bit more vertical, all right? So you can see how my shins, the first move with this is my knee versus the dominant hip hinge. My knee goes forward and I get down to this bottom position. Now, the key is that the knees are very simple joints. So looking straight on like this, wherever the feet are pointing, if your ankles are tight, then oftentimes people will default to this foot out position because of that limited ankle mobility. They can't get over their ankle, and then so their knee starts to go in this direction. So if my thighs don't match the angle of my feet, that's going to put a lot of stress on your knees. So we want to try and, at the very most, turn this out maybe 10 degrees. That's it. Not a lot, not 45 degrees. And wherever your feet are pointing, at the very least, we want those thighs pointing in the same direction as we're doing this move. So this is squat. A single-legged squat would look like a lunge, which is kind of coming back and down like this. We're making that same shape that we did with 2 legs, but now with 1 leg. And this becomes more difficult because all our weight is on one side. The hip hinge we could also do with 1 leg. If I just hip hinge this way like that, I create that same archetype of motion of my hip, knee, and the other leg is balancing the weight of my trunk going forward. So that's the hip hinge and the squat. All right, so let's pull this up here and then get into a very more simple exercises for upper body, just a push or pull. And we talked about how those things can be horizontal or vertical. All right, so we can do the same thing. And I like grabbing something lighter here. If you have a chair or bench, and then, you don't even have to get fancy and get one of these weights. If you have a dumbbell, doesn't matter. You can even just use a grocery bag or a gallon of milk, doesn't matter. It's something to kind of just get you, add some resistance to the movement. So here, an example of the horizontal pulling that you can do with very minimal equipment is a bent over row. I have 1 knee on my bench here. This could be a couch. I have this other foot out so that I am balanced and stable. And then I'm going to hold myself up with this hand, and then I'm just going to pull back with this arm. So the big thing with this is that when we do any push or pull, our forearm is in the same direction as my line of force. What does that mean? That means that the forearm should be vertical as I pull up. It shouldn't be like this. All right, so then my forearm becomes not so vertical. If I'm pulling horizontally this way, because I'm bent over, I'm going to be like this. If you have access to a cable column or some type of machine, and you do the same type of movement, here it is. It's a horizontal row. My forearm is still matching the same direction as my force. It's never like this, where I'm pulling here or pulling here, where my forearm gets out and doesn't match where I'm pulling. It's always pulling in the same direction as my force. If I'm doing a push, we can do like an elevated push-up, right? Where I'm here on the table or bench like this, my body is rigid, and then I go down and I come back up. Now, the higher the elevation, the more difficult it will, or the easier it will be. The lower, if you go down to the floor, it'll be harder. But if we show this in the with the weight, we'll just be lying down on the bench, and then same thing, it'll be a horizontal push in the opposite direction as our pull. And again, forearm angled with the same line of force. We never want to kind of create that faulty angle here and then push out from there. We want to drive through the forearm. All right. And then the overhead press would be very similar, just kind of coming here, forearm vertical, and then up. That's probably a little bit more advanced with the overhead press. And there's a lot of different ways that you can kind of mimic that same motion, like you're lifting something to a shelf. If I was going to do this with my little odd object, my ball, and I push this up, that counts as a overhead press, even though it is not directly over my head. Okay, this is very functional, something putting up on a high shelf, and that's how we, that's how we connect this to our functional fitness routine. All right, and then let's go back to our list here. We can go into compound motions. Compound motions is where we combine all the things that we did together. So compound motions like a thruster or a deadlift row. So if we combine these things, if we think, all right, what's a thruster look like? Well, whatever implement you have, we're going to combine a vertical push with our squat pattern. So if I'm holding this weight here, I'm going to be here, the weight's up in front, I'm going to do my squat and then continue and push that overhead. So this is a very compound motion using our entire body. It's good for like warm-ups and you could actually integrate that into your regular routine. The other one that we mentioned was a deadlift row. So I'll do it with my single here, single kettlebell. I could do my deadlift, right? And then combine this with a row, and then a deadlift, and that horizontal row. So that's another version, another way to kind of create some variability in your workout routine. So again, it's not going to be something stagnant that you're always doing the same movement over and over again. You could integrate a lot of these things into and combine them together. All righty, so let's go back into our slides here. So compound motions. So, those are very simple things that you can do. Oops, here I am, Mario. We talked about carry variations. These are really easy because you just pick up something and carry about 20 feet. You could probably lift and carry heavier things with these. Let's just say, for example, your suitcase or duffel bag, just kind of lift that up, walk with it, trying to keep your core engaged as you do that. And then, sport-specific stuff with rotation. You can take the weight, standing and rotate with them, and then move things side to side, especially if you have like a band or something like that. All righty, so I think that's all I've got for my talk today. If anybody has any questions, feel free to use the chat. I'm going to give it a couple seconds and I'm going to sign off. All righty. Okay. Well, thank you so much for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I'll be back Tuesday, July 9th, next month, Tuesday, July 9th, for a class entitled Knee Health, Prevention and Rehabilitation Strategies. We're going to explore the intricate anatomy of the knee and learn how this vital joint, how to keep this vital joint healthy and injury-free. All right, we're going to talk about ACL tears, meniscus tears, patellar tendonitis, and discuss factors contributing to those occurrences. So you already know about that alternating pattern of stability and mobility. So there's a little preview. All right, we'll explore strategies for rehabilitation, recovering from knee injuries, including post-injury exercises, modalities that if you have access to that, and return to sport protocols. All right, so whether if you're an athlete, fitness enthusiast, or someone interested in maintaining your knee health, aren't we all? This session will provide you with valuable insights into preserving the integrity of this crucial joint. All right, if you have any questions, feel free to email me at paul@par5pt.com or team@betterspaces.com.